with this video, I'm going to go through 3 things that you can do if you're getting pain into your bottom and down the back of your thigh. Hi, I'm Zoe. I'm a physiotherapist and founder of Pilates Health Online. Today I'm going to go through 3 things that you can do for something called Piriformis Syndrome. Now, Piriformis Syndrome comes from a muscle that sits just deep down in our bottom, so it's underneath our bigger glutes muscles, and it's a triangular muscle that sits really close to our sciatic nerve, and that's the nerve that goes down the back of the leg and into the foot. So sometimes this muscle goes into spasm, and when it goes into spasm it can irritate the sciatic nerve and put a little pressure on it, and that's where you tend to get this pain sort of down into your leg, commonly sort of not really past the knee, commonly sort of into the back of the thigh. Sometimes as well, in some people, the sciatic nerve actually goes through the middle of this muscle, and obviously it's impossible to tell who's got the sciatic nerve that goes through the middle of that muscle, but obviously if that does happen, then that's going to squeeze on the sciatic nerve a little bit more, and that can obviously give you more symptoms. So there are 3 things that you can do to try and help with this problem, and the first one that we're going to go through is using massage to help. So I've got a spiky ball, and as you can see it looks a bit like one of those tumble dryer balls, but it's got little spikes on it, but it's quite soft, it's not too firm. And this is a really nice thing to use because it's got lots of little bumps on that really get into that muscle and really sort of help to get rid of any knots or any muscle spasm. It's also a really good thing to get circulation and blood flow into the area as well, which will also help. So what you can do with this is you want to find the tender point on the bottom that's the most sort of sore, that little bit that you sort of feels a bit like a bruise. And what you want to do is just come and lean up against the wall, is the best thing to do. So have your feet at distance apart, place the ball and just find that tender spot into the bottom, and then you want to just gently lean onto the ball. And then from there you can just gently press in, and it'll sort of, it's weird, it feels like sort of a nice pressure, a nice pain. And then what you can do, if you transfer your weight side to side through the feet, you can just feel the ball just gently rolling along that muscle. It just sort of massages out those little knots. And as I say, it's quite a pleasant sensation, if you like. So you want to keep the length through the spine as you're doing this, and just gently transfer side to side. Now you can also just bend the knees and come up and down a little bit as well, and just go across that muscle just to get rid of, again, some of the tension. Now if you haven't got a spiky ball, you can use a tennis ball. That will still have a similar effect, but obviously you don't get the benefit of those little sort of knobbly bits that really get into that muscle to help. So that's the first thing you can do to help, is to massage that muscle. So the second thing that you can do is to try and stretch the muscle out a little bit. Now, piriformis is a funny muscle that it doesn't really like being stretched. So if you're doing stretches, you want to be nice and gentle with the stretch and not really try and overstretch, because what will happen if you do that is it will just go back into more spasm and it sort of makes the whole situation worse. So there are a couple of ways that you can stretch out the muscle. So I'm going to show you those now. So to stretch the side of the hip and stretch the piriformis muscle, then you can do that in 2 ways. You can do it in sitting or you can do it in lying. So I'm just sitting just on a block or a cushion just to sort of take the pressure off the lower back a little bit. So what you want to do, if you're going to do it in sitting, is you lengthen the leg out that you don't want to stretch. So this is the leg I'm going to be stretching, and then you pop that foot over the other leg. And then what you want to do is think about coming to sit up nice and tall. So imagine someone just lengthening you up through the spine. Now that might be enough that you feel a comfortable stretch, in which case that's all you need to do. You don't want to go into a deep stretch. Now, if you don't really feel anything, then you can bring the hand across and you just gently pull the knee a little bit in towards you, keeping that length through the spine. And you can just gently twist as well, just to the other side. And you should feel a nice, comfortable stretch. Now, if you tend to slump round into the lower back, you're going to lose that stretch through the bottom. So you need to keep nice and tall. And you want to hold it there for maybe about 15 to 20 seconds. And it shouldn't increase the pain down your leg. That's quite important. And then come out. Okay, now if that position isn't comfortable, the other way to stretch out is to come down and have a lie down on your back. So you want to find a position where you've got length through the spine, you're nice and comfortable. bent up, and then you're going to cross one leg over the other. Now again, that might be enough for you to feel that comfortable stretch, in which case that's all you need to do. If you can't really feel anything, you can either bring that other leg so that you come onto the toe, and you bring the heel a bit close to the bottom, and that should increase the stretch. And again, if you still can't feel anything, then just supporting the legs with the hands, you can gently lift, and that should give you that nice stretch. And you just again want to hold that there, keeping the length through the spine for about 15 or 20 seconds if you can, and it shouldn't increase the pain down the leg. And then coming back, and then coming out. Okay, so that is a way to stretch your glutes muscles and just to try and stretch out that piriformis muscle. The third thing that you can do is you want to try and strengthen those bigger glutes muscles around the side of your hip, because sometimes what happens is the piriformis muscle goes into spasm because the bigger glutes muscles basically aren't doing their job and they're not as strong. So that smaller muscle that sits underneath tries to take up some of that strain, and because it's not designed to do that work, then it goes into spasm because it's been overworked. So what you can do is strengthen around the hip. So to do that, we want to come and have a lie down on our side. And you want to make sure your head is supported with a block, and you're lying completely on your side. So you want to think about lengthening through the waist rather than sort of sinking down into the mat. Have your knees bent into a little V shape and your heels lined up with your sort of bottom or sitting bones. And then from there, you want to imagine there's a wall behind you so you can't roll yourself back. And you're going to gently try and lift that top leg and then come back down. So you're breathing out, lifting and lowering. Now sometimes it's a little bit of an issue because if that piriformis muscle is overworking, and as soon as you start to do that, you might find that that muscle starts to kick in and overwork. So what you could do is start off with a block between the knees. I'll just use these to show you. So you're starting off here, and then you're just starting by just trying to lift and lower. So you can see that's the tiniest of movements. Think about drawing your sitting bones together, and that should try and get those glutes activated and try and switch off that piriformis. Once you've done that, then you can go back and you can start doing the harder level stuff. Okay, so that was just three things that you can do to try and help if you are getting the this Piriformis syndrome, this pain down the leg. Now what I should say is that's not the only reason that you can get these symptoms. So if you just have a read below this video, I have popped a couple of things that you do need to look out for, and as always, if you're in any doubt as to what's causing your pain, then I really would advise that you go and see your health professional, your GP, to get this pain properly diagnosed, and obviously you can get some extra treatment as well. So thank you for joining me. If you want to if you like our videos and you want to see more, then if you subscribe to our YouTube channel, then as soon as we release any more videos, then obviously you'll be the first ones to know. So if you want to do some exercises that are going to help with Piriformis syndrome and help sort of get rid of that tension sort of into the bottom and down the back of the leg, then I have done a short class that you can do with me. So if you want to get hold of that class, there's a little link at the bottom of this video. You can just enter your email address and we'll send you the link. And we're going to go through some exercises that will help.